Miss Purple, the right mind for any time. I created this podcast to raise the awareness of mental illness. If you have any of these symptoms, notify your physician or call 911. Another suicide hotline is nationwide is 988. Thank you. Mrs. Purple, the right mind for any time. My name is Deborah Sanders, a.k.a. Ms. Purple, born in Akron, Alabama, but raised in Birmingham, Alabama. I started nursing early in my career. I was a candy stripe. From then, I was a nurse attendant, an LVN, an RN, BSN RN, and 2 years of graduate school. I have worked at numerous facilities in Los Angeles County, federal government, and now I'm employed in a private sector. The purpose of my podcast is to make people aware. If people are not aware of certain situations, they get into all kinds of trouble because of awareness. Today, I want to discuss the 3 most prevalent drugs that rampage our young people. Fentanyl at the top of the list, next is meth, and the third one is marijuana. Fentanyl came about for people with chronic pain. It's a synthetic opiate that made in the pharmaceutical, but it was made in 2 different ways. It was a lozenge, it also like a tablet that fit under your tongue, and also was a patch. When I used the patch in the hospital, I put it on the person, peels off and stick on the person, and you use the date and time, it lasts 72 hours. Now, current with the drug crisis, and people can't hardly get narco, now the Chinese is supplying to Mexico fentanyl in a powder form. And they mixing the powder with similar to a Percocet. But the ingredient of this pill does not have a Percocet ingredient. Only thing they have in is fentanyl. Look at the top of your salt shaker. The hose is in your salt shaker. You can ingest a pill with that minute amount of fentanyl. 5 or 10 minutes later, even early, you become lethargic, you become sleepy, and later on you go into comatose. This medication is very potent, and it's killing a lot of our young students in the school, as well as adults, and many people that on pain medication tend to turn towards street drugs. Fentanyl is made like sweet tart. They got the different color of the fentanyl on the street now. And with the different color of fentanyl on the street, it's more attracting younger kids, young adults, and high school kids. This drug is very dangerous. Unless someone get Narcan to you quick enough, then you won't be alive, you'll be dead because the drug suppress the respiratory system. Now we're going to talk about meth. Meth, amphetamine, some people call it crack, some people call it glass. Meth, it can be sniffed, it can be used in a pipe. It also can be used as an injection. Meth tend to take over the dopamine of the brain. When people taking meth, they lose their appetite. Some people, their teeth get bad, their skin get bad, they're hyper as far as the vital sign. The temperature can get high, the blood pressure get high, respiratory get high, and the pulse get high. And with meth, people using meth with marijuana and meth with other drugs to make meth much more potent. Meth is so easy to be made. It can be made in your house, it can be made in your garage, it can be made in your car, it can be made anywhere. And some of the things with meth, when you make it, it can be such an explosion where it may burn you. It also can take off your finger when you're making meth. That's just how explosive meth is. Meth have a long-term effect. And when people get off meth, they say they feel suicidal, they feel drained, they feel worthless. They feel better being on meth than off meth. I have not seen one age group off of meth. I have seen people as little as 12 years old to as high as 60-some years old because they said the feeling that the meth get in. But it's a dangerous drug also. You can die with your vital sign being up high. You have to end up going to the emergency room. Our next drug is marijuana. This is not the marijuana that your uncle grew in the pot in his backyard or the marijuana they grow in the field. This is synthetic marijuana. It's made in the lab. And when it made in the lab, it got over 100 to 150 chemical in this marijuana. Even though the state of California have it legal, other states have it legal, but it's not legal in the federal guideline. So if you come to the hospital with your marijuana, we are not going to keep it, we're going to discard it. Because if you're getting Medicare, you cannot have marijuana at the hospital a person come to. Marijuana to some kid, they say, oh, it's legal, we don't have to worry about it. But the way they put the THC in the marijuana, it makes it so potent until a person becomes psychotic when they smoke marijuana, or they become delusional. That's what marijuana do. It's not the old marijuana that you used to. This is the new marijuana. And also, women had to be careful in smoking this marijuana because in childbearing, and when you smoke this high potent marijuana, it can distort your child brain. So I hope you all look to where you get the marijuana from and see that it's not the same old marijuana. It's laced with high THC. In retrospect, when you're dealing with drugs or substance abuse, it can cause you personally problem. It can cause you cardiac problem. It can cause you renal problem. Eventually, you can go to the hospital, or eventually may lead to death. Also, drug abuse can affect the family. Long use of drug turn a person be psychotic. And at that point of psychotic, family member had to come in, step, and take you probably to the emergency room and see where you talking to yourself and acting bizarre and tearing up things. So it affects the family too. The drug also affects the hospital, especially the hospital emergency room. They can spend billions to trillions of dollars each year treating people come in with drug-induced psychosis or cardiac problems related to drugs. The incarceration. Drugs sometimes lead people to stealing, lead to people to doing things they usually wouldn't do if they wasn't taking drugs, and cause a burden on our incarceration system. Drugs as a whole can affect the whole community, because when people start using drugs, they're not going to pay the rent. Then they're camping out in your neighborhood as a homeless person. So my thing is just be aware of what you're taking. It's not telling you don't do this or don't do that. It's making you aware that the situations is out there and they're very dangerous. Thank you very much for listening to my podcast, Miss Purple, The Right Mind for Any Time.